And cervical cancer is one of the most preventable and treatable cancers if managed early with adequate prevention, screening and treatment tools. I'm joined by Dr. Solomon Mutua in studio as we look more into matters cervical cancer. Dr. Mutua is an oncologist at the Nairobi West Hospital. Many thanks for joining us, Dr.
Thank you, Lillian.
Now, a conversation we've just been having with you prior to this interview is that cervical cancer is the cancer that kills most women in the country?
Yes, you'll find that breast cancer is the most common cancer, followed by cervical cancer. But when you look at which of the two causes most mortality, the cervical cancer actually beats breast cancer in terms of mortality.
Mm-hmm. Yeah. Why would you say that is the case?
It's just how the natural history of the disease goes. You find some cancers tend to be more aggressive than others. Yes, we have breast cancers that are aggressive, but you'll find that considering how late or how and when we catch cervical cancer and just how the disease naturally occurs, you find that it ends up causing more deaths than the breast cancer.
So depending on how early you catch it would lead then to better treatment outcomes. Let's talk about screening. Yeah. In terms of screening, when should you start the screening in terms of age, and how frequently should this screening be done, and what tests are we looking at?
Okay, I'd like to start by answering the question, what is screening? Mm-hmm. So screening is basically looking for cancer or abnormal cells that may lead to cancer in patients or people who don't have any symptoms. Okay, so you're just looking at your normal lady without any symptoms, and there are tests that you do. Mm-hmm. So the tests that are recommended for screening here are your pap smear and your HPV tests. Okay, and the ages we should begin screening are usually after the age of 21 years old. Okay. And the rationale is that around this time most people have already started indulging in sexual activities. So, and we all know that cancer of the cervix is sexually transmitted through the HPV virus. And so screening should start from the age of 21. How frequently? It's divided into the ages of 21 to 30, okay, and from the ages of 30 to 65, and then above 65. So for ladies between 21 to 30, then usually we recommend them to do a pap smear, okay, every 3 years. And usually what happens is cell samples are gotten from the cervix, and then they're tested in the lab to see if there's any abnormal cells that may lead to cancer. Mm-hmm. Once a lady reaches 30 years to 65 years, then there are two options. One, they can either do the pap smear, which would be every 3 years, okay, or they can do what we call co-testing, where you do the pap smear plus the HPV test. Right. And the good thing about this is that the frequency is a bit elongated, yeah, and instead of 3 years, now we recommend for 5 years.
So in terms of the facilities, because we're looking at adequate prevention, screening and treatment tools being key, in terms of the facilities that are available in the country for a woman in far-flung areas of the country, what symptoms to look out for in terms of, signs that somebody could have cervical cancer, and in terms of the screening facilities as well, how much of a reality is this for women in far-flung areas of the country? Would they then have to come to modern facilities, say here in the capital city? Okay,
cancer, unfortunately, it's usually a game of resources, okay, and you'll find that most of the resources, of course, are in Nairobi, basically. Yeah. And cancer also, especially cervical cancer, is more of a socioeconomic problem. So you'll find that patients in far-flung areas usually don't have resources, so you'll find even their main objective is to get something to eat, okay, as opposed to seeking for health services, okay. But yes, the government, I think, usually tries to spread out these screening facilities, and I'm sure that they are spread in the country, but it's mostly in the bigger cities and the bigger...
Right. So warning signs, what to look out for?
Early cancer of the cervix, just like most cancers usually, are without symptoms. Okay, that's why screening is very important. Okay, so by the time you start getting symptoms, already this is not early. It's either locally advanced or already advanced. But the commonest signs and symptoms are usually vaginal bleeding. Okay, you can have vaginal discharge. You can have pain during sexual intercourse. You can have pain during passing urine. You can have hard stool, okay? And depending on how extensive or how advanced it is, if it has spread to other parts of the body, then the signs usually and symptoms depend on which part it has spread. Like if it spreads to the lungs, you'll have difficulty breathing, chest pain and all that. In the abdomen, abdominal pains. In the brain, and you can have headaches, collapse, convulsions. So at this point, usually, the symptoms depend on how advanced it has gotten.
We're talking about screening so that you can catch it early. So in terms of treatment options,
yes,
what is available? Because there is hope. We're selling, hope as a reality. Because
yes,
the earlier you do, and that's what we keep pushing when we do the cervical cancer messaging, the earlier you go for screening, then the better the treatment options, if indeed, there's found to be some cancerous cells. Treatment options?
First of all, it's always good to remember that cancer is curable. Okay, it's not always a death sentence. It always depends on how soon or how early we get it. Okay, and we are lucky in Kenya. Things have changed, and most of these, I'd say almost all treatment modalities are there. And for example, in Nairobi West Hospital also, we are fully fledged cancer center, and we have all these treatment modalities. So treatment of cervical cancer usually is divided whether it is early disease, locally advanced disease, or advanced disease. So when we catch it early, you'll find that in this case, surgery is the go-to option, because you want to surgically remove mainly the cervix and the uterus, and sometimes depending on which type of cancer of the cervix, we also remove the ovaries. And once this is removed, it's taken to the lab so that it can be investigated under the microscope to see if we need to add any more treatment. And here we are talking about radiotherapy, or radiotherapy plus chemotherapy. When the cancer is locally advanced, meaning it has started going into the neighboring structures, then this is a stage where surgery doesn't help, doesn't work. And in this case, usually we combine chemotherapy and radiotherapy, and we give the treatment over around 5.5 weeks of treatment. And usually, most of the time, we are able to cure patients with radiotherapy combined with chemotherapy. Now, when it goes to advanced disease, this is what we call metastatic disease. You'll find that, unfortunately, this is a stage that usually is not curable. And surgery, of course, doesn't apply in this case. And most of the time, you find we recommend what we call systemic therapy that goes into your body system and fights the cancer cells wherever they are in the body. And this usually includes your chemotherapy, which can be combined with your target therapy, and nowadays we have even immunotherapy. So at this point, usually you find the main aim of treatment is to control the disease, okay, improve the symptoms, improve quality of life, and prolong life for as long as possible. There are some cases where you have a patient with advanced disease who, yes, would need systemic therapy, but have some symptoms that need urgent control. Let's say like intractable pain, uncontrollable bleeding. So these are cases where we will also recommend radiotherapy so that we get rapid control as they continue with the rest of the systemic therapy.
So as we close, Daktari, for our viewers at home, maybe somebody has just been diagnosed with cervical cancer and looks at this as perhaps a death sentence, in as much as doctors have told them that, it's early enough. Have you interacted or have you been in contact with persons in your profession where there's been success stories, people that have totally recovered and have lived normal and healthy lives after undergoing treatment once the cancer is caught early?
No, definitely. Of course, in our clinic at Nairobi West Hospital, we have both sides of the coins. We have success stories, and of course we have a few who are not so successful. But majority of our patients, yes, we have successful stories, people who have good testimonies of what we've done to them. And basically, they are always a blessing to remember that this is a war that we can fight, and this is a war that we can win.
Right. Many thanks. We've been talking to Dr. Solomon Mutua. He's an oncologist at the Nairobi West Hospital. Remember, the key fact out of all of this is to go